Leptospirosis is re-emerging as a potentially serious bacterial illness. In fact, its incidence is widespread, and its reappearance is being recorded not only in the usual rural and blue-collar working environments, but also, with increasing frequency, in urban and suburban areas. Leptospirosis can cause acute renal failure in dogs. It can also infect people with illnesses whose symptoms are similar to tropical diseases. Dr. Larry Glickman, professor of epidemiology at Purdue's School of Veterinary Medicine, has researched leptospirosis for 3 decades and has seen its reemergence.
Leptospirosis is a very severe acute disease of dogs. Many of these dogs present an acute renal failure and liver failure. And this is not a new disease. We know about this disease for over 100 years. It was first described in dogs in approximately 1898. And it was about 1960 when the first vaccines were developed to combat the 2 most important strains of lepto, which were canicola and ictohemorrhagia. And with the use of those vaccines, the frequency of disease in dogs in the United States, at least, declined markedly and stayed at very low levels for approximately 30 years. And then for some reason that we don't fully understand, starting around 1992, 1993, we started to see a marked increase in the frequency of lepto in dogs, first in the Northeast and then spreading throughout the eastern region and to the central United States. And no one really understands why we saw that increase, but what was interesting is not only did we see an increase in frequency, but the 2 most common serovars previously that caused lepto in dogs, canicola and ictohemorrhagia, were hardly seen. And what we were seeing were 2 new serovars called Grippo typhosa and Pomona.
The good news is that leptospirosis is preventable in dogs. In the past, vaccines have controlled the incidence of the disease by protecting against the primary serovars canicola and ictohemorrhagia. But the bad news is that the incidence of canine leptospirosis associated with other serovars, namely Grippo typhosa and Pomona, is on the rise. In other words, leptospirosis is back, and most current canine lepto vaccines do not protect against clinical diseases caused by these 2 emerging serovars. Grippo typhosa and Pomona have been associated with fever, lethargy and myalgia, hepatic disease, and acute renal failure in dogs. Due to the recent emergence of Grippo typhosa and Pomona as significant causes of canine leptospirosis, it's necessary to understand what the sources of these serovars are. The primary reservoirs for these newly recognized serovars are commonly encountered in wildlife, such as raccoons, opossums, skunks, and rodents. Virtually all dogs are at risk of being exposed, whether they live in a rural environment, a suburban, or urban neighborhood.
There are over 250 serovars of Leptospira that can cause disease in animals and people. Many of these serovars normally live in wild animals. So the important serovars, Grippo typhosa and Pomona, for example, can be found in animals such as raccoons, skunks, possum, small rodents, and even some domestic animals. And these animals carry the organism, often show no clinical signs, but shed the organism in the urine. And then when other animals or people come in contact with this contaminated urine, they can be infected. We believe that serovar Grippo typhosa, which is probably the most important for dogs, is primarily being transmitted to these dogs from raccoons, contact with raccoons directly, or water contaminated by raccoon urine. Leptospirosis is considered one of the most widely distributed zoonotic diseases in the world today. Virtually every country in the world reports cases of lepto in both in animals and people. And this is probably because it is shed in the urine and is highly transmissible.
The symptoms in humans are typically fever, headache, chills, nausea, and vomiting. In severe cases, leptospirosis can result in liver damage, jaundice, kidney failure, and internal bleeding.
There have been instances where kennel workers have been infected by lepto because there was a dog in the kennel that was infected and was shedding the organism. And on a few occasions, this has resulted in unfortunately, in death of the person infected. If an animal presents with signs compatible with lepto, one needs to take precautions to make sure that people working with the animal directly or cleaning the cage understand the risks and take proper precautions, which would be things like wearing gloves, using appropriate disinfectants on the cages, and just generally being aware that there is a risk associated with being around and handling the waste from these animals.
Leptospirosis is indeed reemerging as an important canine disease. The incidence of clinical disease associated with leptospirosis is increasing. Veterinarians are warned to look for the pathogen in cases of kidney and liver disease.
The most common clinical signs we see in dogs infected with these serovars of lepto, particularly Gripo typhosa and pulmonar, are acute onset of anorexia, vomiting, fever, and lethargy. And in many of these animals, even if aggressively treated with penicillin or the tetracyclines, will go on and develop acute renal failure, so they'll have elevated BUNs and creatinines. If it involves the liver, they will show signs of hepatic dysfunction. They'll have elevated liver enzymes, and a small percentage of these animals will be overtly jaundiced.
Fort Dodge Animal Health has added the two new serovars, Gripo typhosa and Pomona, to its current Leptospira vaccines. Veterinarians now have a way to offer protection for their patients from today's deadly Leptospira challenges.
It became apparent that the current vaccines would not protect dogs because these were two new serovars. And it was about 2000 that Fort Dodge developed and marketed a new vaccine containing serovars Gripo typhosa and Pomona, in addition to the two more common serovars seen previously, ictohemorrhagia and canicola. And currently, this is really the only lepto vaccine on the market that will protect now against these two important serovars.
To minimize the safety concerns commonly associated with the use of vaccines containing whole-cell Leptospira bacteria, Fort Dodge Animal Health uses an innovative process to manufacture the Leptospira vaccines. Duramune Max Leptospira vaccines are made with an exclusive subunit manufacturing technique that involves separating the surface immunogens of Leptospira from extraneous cellular debris. Protective surface immunogens are extracted from the Leptospira bacteria under closely controlled conditions. Potentially harmful cellular debris is discarded. Remaining surface immunogens are retained. The purified immunogens are used to produce the vaccine. The result is a vaccine which is virtually free of intracellular debris. For animals and pet owners, the result is an effective vaccine that guards against the recurrent emergence of leptospirosis. For more information about vaccine protection against leptospirosis, contact your Fort Dodge representative.